Hello, I'm Robert Hardesty, a board-certified plastic surgeon practicing here in Riverside, California. Today's topic is surgical and non-surgical options after massive weight loss. First of all, what is massive weight loss? Well, there's various definitions, but it's usually 20 to 30% weight loss from your highest weight. So let's say you went from 300 pounds down to 220, 250. That is a massive weight loss. What happens after weight loss? Well, just as in pregnancy, the body expands and the skin expands. But unfortunately, the elastic fibers don't always come back. And so what happens is there can be a general deflation starting at our face all the way down to our knees. There can also be areas of diet-resistant fat. So, what is diet-resistant fat? Diet-resistant fat is fat that no matter what you do through diet and exercise, it accumulates. We're all born with so much fat, so many fat cells. They just get larger and they get smaller as we gain and lose weight. But in some areas, genetically, this fat may never go away, often found around the knees, the love handles, the abdomen, and arms and inner thighs. So what are our options? Well, let's start with the face. A lot of times the face will become ptotic. What does ptotic mean? I look at it as sort of a dripping candle. The wax drips down and so does the skin and the undermining tissues like your muscles. So we have everything from brow lift to eyelid surgery to facelift, neck lift, coupled with our non-surgical treatments such as core, CO2RE, which is CO2, radio frequency, and we often couple that with PRP. Okay, let's move down. What also happens? The breasts tend to sag. And when the breasts tend to sag, they not only lose volume, but they also lose support. And so that the nipples, instead of being up where they should be, tend to point down and elongate, and they become pendulous. Pendulous means that the weight of the breast is at the bottom like a pendulum and narrows at the top. So we can do a mastopexy. To get fullness there where the weight is lost, we can also do a breast augmentation. What about the arms? The arms, same thing. The skin can sag. So we can do a brachioplasty. The standard brachioplasty has an incision down the length of the arm, or what we call the invisible brachioplasty. Really not invisible, but the scar is in the armpit area. Abdomen, classic, is the tummy tuck. Often we'll do an extended tummy tuck because of getting the extra tissue out around the sides. The lateral thighs, we can do a lateral thigh lift to bring up that lateral thigh tissue. And then going all the way around is called the buttocks lift. And if we couple the buttocks lift, lateral thigh lift, and extended tummy tuck, that's the body lift. Okay, inner thighs. A lot of times that inner thigh tissue will be lax, ptotic, and get in the way of clothes or exercise. And we can do an inner thigh lift. There's two types. One goes, an incision that goes down in the mid-thigh, or another one for a more minor is the bikini line inner thigh lift. Lastly, the knees. Often we just do liposuction, but often we'll go ahead and take out the extra tissue with surgical excision if we need to. Lastly, let's put this in conclusion. Surgery after massive weight loss has various options. It will address the areas that the patient has concerns about. They can include facial, breast, arms, inner thigh, lateral thigh, buttocks, and the knees.